Hi everybody, welcome to week 7. This week we're going to be covering IV medications still, but we're going to be looking specifically at titrated medications. So when we're discussing titrating medications, what we're looking at is dosages where we have a range that we can be within. So maybe we give them a little bit and we have one thing happen, and we give them a little bit more and something different happens, or something happens better, or however you want to think about that. So titrated medications are typically used in critical care. So it's going to be something that happens rather quickly. So in other words, these are medications where you can make a slight adjustment and you're going to see remarkable changes type of thing. So you're going to see in this particular chapter that they're going to talk about being prescribed by the dosage or by body weight. So we're going to be looking at those two things. So I've actually sent out a sample problem to all of you, but I want you to keep in mind that the key idea here is using the range. So this is an example. We have a particular drug to maintain systolic blood pressure, and in order to maintain that specific blood pressure of 100 millimeters of mercury, we want to give them of this particular drug anywhere between 1 and 3 micrograms per minute. So we're going to actually be calculating both the top and the bottom range of medication, so that we know which amounts to start with. So typically we'll start off with the lowest amount and work our way up to the highest amount. So kind of keep that in the back of your mind as you're working these problems. These particular types of medications are typically infused using an electronic infusion set. So when we talked about sets last week, we looked at manual and electronic. So these are typically used with electronic sets, and that allows us to be even more specific, so we can get those amounts down to the very most minute detail that we need to. So here's just one example. This one says to calculate the milliliters per hour flow rate for a dosage strength of 125 milligrams per 100 mil, and we want to give them 20 milligrams per hour. So what you're going to be doing here is you're going to be looking at, and this one, just to kind of put it out there right away, this one does not give you a range. We're only looking for specifically 20 milligrams per hour. So what you want to do is you want to put on one side of the equation what the dose is that the doctor ordered. Okay, so this is no different than what we did earlier in the course. So the doctor ordered 20 milligrams, and that's going to be over X milliliters. The way the medication comes is 125 milligrams per 100 mils. Then we're just going to do our cross multiplication and solve for X, just like we've done previously. So we're really not doing anything terribly different on some of these problems. You just have to make sure that you're reading that order very, very carefully. Now, the second example on this slide deck shows you, well, what happens if what the doctor ordered and what we have available is different strengths. Okay, so this is an example of that. We're supposed to calculate the milliliters per hour for a maintenance dose of 2 micrograms per minute. So the dose ordered is 2 micrograms per minute. What we have available in stock is 8 milligrams per 250. Okay, so the first thing that they're having you do, and you can do these steps in reverse orders, so to speak. So the first thing that they had you do is, first of all, figure out how many micrograms that will be in a whole hour. So we said 2 micrograms are in 1 minute. So there's 60 minutes an hour, so that's a total of 120 micrograms. So that's the first piece that they did. They figured out how many micrograms will we need for a full hour. Then they said, okay, well, we're talking about micrograms here, but what we've got in stock is milligrams. It's 8 milligrams per mil, per 250. So what we have to next do then is convert our micrograms to milligrams. So we're converting our order unit into our stock unit. Remember, we always want to convert our order unit to our stock unit. We can't change what's on the shelf. We can only change what the doctor ordered. So we do that by converting micrograms to milligrams. We're going to use that 120 because we've already figured out that we needed 120 micrograms in an hour. So that's 0.12 milligrams. And now we're just going to do like we did in example 1. We're going to use that information, that 0.12, and we're going to figure out how many milliliters will we need to get to 0.12. It comes 8 milligrams per 250. So again, just cross multiplying. So as you're going through these problems and keep in mind that we're not really introducing anything terribly new. We just have to make sure we're reading these really, really carefully. So check your email. I did send you an example and I kind of walked through it in Word format. So if you're not a auditory learner and you don't like listening to me talk, I put it into a Word format. But if you have any questions at all, please make sure you reach out to me at any time. You may email, call, or text if you have any questions over this week's material. And have a great week.